have an update for you from the City of Lawrence. In this update, I'll discuss our census response, new housing, and the latest information we have on the COVID-19 virus. Statewide, South Carolina is tied with Louisiana for last place in responding to the census. Only 45.1% of Lawrence residents have returned their census forms. Now, all the way back in 1787, when the founders knew that a census was necessary and if the United States government was going to be able to serve the citizens of this nation, they wrote it into our Constitution. So, since that time, the census has helped us determine the number of representatives in the United States House. We've used it for historical research, so we can learn more about our ancestors, and a whole lot more. But you should know that there are some present-day reasons to participate in the census that directly affect you. When I was elected, I made a commitment to bringing additional business and housing to Lawrence. Since that time, I've had the privilege of bringing all sorts of potential investors to our city who are considering rehabilitating old buildings, building new housing, a hotel, restaurants, and more. And they like what they see. But when any business professional is considering making a significant investment, they need data to support that decision. It looks like we have all the right ingredients for success, but it's better to see those ingredients in black and white. That's where you in the United States Census come in. Right now, we're using roughly 10-year-old numbers, which have been updated by the U.S. Census Bureau, but those numbers will be updated. The question is, will the updated numbers be accurate? The picture of what our city and county looks like in terms of population size, age distribution, household size and income, and the growth and changes that have occurred since the last census are all factors that businesses consider. Despite our current challenges with COVID-19, we had some really positive changes take place. Now we need to make sure that we give the census an accurate picture of all those good things. On top of being able to present accurate figures to those who are looking to help us grow, we need to be accurate in our information that we are giving to programs for grants and federal funding and state funding for our hospital, schools, education programs. We need your help. If you want to see Lawrence thrive, improve quality of life, and attract well-paying jobs, we need you to participate in the census. It only takes a few minutes to complete, and it's one of the most important ways that you can help Lawrence grow. We can't do it without your help. Now, I want to tell you about some other good news. Tomorrow, the Lawrence City Council will be hearing a request for a resolution. We'll be meeting with proper social distancing and streaming it live for the public, but we'll hear from Census Homes, who will be building new homes in the Washington Heights neighborhood. Plans right now are to build 4 new cottage houses and 4 new duplex units, which will add 12 new housing units to the city. This new construction will be the latest addition to a surge in construction, which has happened around town and has seen more than 25 new homes built in the past year. We'll also continue to see improvements and renovations. You can see that happening all around town. Most notably the Lawrence Museum and their new elevator and renovations, the Capitol Theater and the improvements they've made on their rear facade, and the Midtown building next to City Hall that's gotten a complete overhaul. As we work alongside the Lawrence County Development Corporation, the Chamber of Commerce, and the South Carolina Department of Commerce to bring new business and industry to Lawrence, it's important that even in difficult times, we press forward with our goals. I'm determined that we will grow in the midst of adversity. And for many who have experienced terrible hardships as a result of living the COVID-19 experience in the big city, Lawrence may seem like a more attractive place to live and work than it did just a few months ago. Statewide, there are 142 new confirmed infections today. 5,613 confirmed infections total. There were 8 deaths yesterday, and that brings our total fatalities to 174. In Lawrence County, there were 7 new cases yesterday, 6 today, bringing our county total to 35 confirmed infections with a possible 207. This 2-day spike in infection comes 1 week after the relaxation of the restrictions which were put in place to prevent the spread of infection. I can tell you that among the individuals who was tested positive, there's at least one individual who had no idea he had the virus, had no symptoms. And while that individual may fully recover and experience very minimal effects from this illness, it's that person's effect as a silent carrier that should concern us. The spread of infection across our area poses a risk to our first responders. In order to maintain our EMS services, maintain law and order, and provide fire protection, we must make sure the virus doesn't spread like wildfire through the shifts working in close quarters who are providing those essential services. Thankfully, by pressuring DHEC to release additional information about the location of infected individuals, we're able to give first responders additional information before they respond to calls. This protects not only our first responders, it helps make sure they don't become agents of infection among the general population. We're doing our best to make sure first responders have all the personal protective equipment they need too. We're grateful to Duke Energy for their donation of hand sanitizer and several hundred masks. These PPE supplies are still in short supply in healthcare facilities across the state. Despite our precautions, we've had some first responders who needed to be tested for the virus. Thankfully, due to the cooperation of Prisma Health, we are now able to get those results back in 24 to 48 hours, a major improvement over the time it was taking to get results back from DHEC. We're using 56% of the hospital beds available across the state. Of the 1,754 ventilators, South Carolina is using 353. We're especially grateful for the efforts of those private individuals who have sewn masks to give to their family and friends, and we thank all those who have been wearing them in public. Let me be clear. If you're not wearing a mask in public, you're ignoring the advice of the White House, the governor, DHEC, and the CDC, and you're putting your health and those that you love at risk. If you go outside your home, please, please, please wear a mask. If you or someone you know has symptoms, please contact the Prisma telehealth line. They'll do a screening, and if your symptoms warrant a test, an appointment will be made for drive-through testing. However, there are still individuals who may not experience significant symptoms who will carry the virus and pose a danger to others. So, follow the governor's order to stay home. Our police have had to respond to several calls involving large parties. Remember, the governor's stay-at-home order is still in place. Many people have asked when things will open back up. As for the city and county openings, we're looking to guidance from the governor's office. It's his call. We cannot take action locally that would violate the orders in place. That would be unlawful. We do not want to take action too quickly that would lead to a spike in infections. That would be careless and unwise. I promise to tell you the truth and give you the facts about what we're facing. In the decisions I make locally, I'll be guided by the facts, the law, common sense, and a moral obligation to protect the lives and health, and yes, livelihoods of our citizens. There is no question we all want to get back to normal as quickly as possible. I know you're tired of all this. I certainly am. I want businesses to be back open and thriving. I want families to be enjoying spending time with each other and their friends. I want the sanctuaries of our churches all across our city to be filled on Sunday mornings, live in person. But, as my father is fond of saying, nothing difficult is ever easy. What we're facing is very difficult. We're fighting a war against a virus. And we were very successful in that war during the battle that lasted the month of April. Our infections were kept low because we did the hard things that needed to be done. But now, as we see the result of our patience and hard work and sacrifices, we can't wave the white flag and give in. Which of your neighbors are you willing to look at face to face and say, I'm willing to sacrifice your life or health? We can't resign ourselves to the idea that some folks are just going to have to die. And we can't delude ourselves into thinking that if we just tell the folks who are vulnerable to stay home, then all the rest of us can get back to life as usual. That's just not the way this virus works. There are none of us who are immune. We are all vulnerable. And yes, some of us may not carry as high a risk of death as others, but all of us are susceptible to becoming agents of the enemy, carrying the virus to the most vulnerable without even knowing it. With that said, the need to go on living and earning and supporting our families is a difficult challenge too. None of us should demonize those who are ready to get back to work so that they can earn honest living and support themselves and their families. We've seen that the aid which has been promised to businesses has been difficult to obtain, and our unemployment system is swamped unlike anything we've ever seen in our lifetimes. Yet even while these systems fail us, life must go on. So we're looking for ways to help these folks and advocate for them so that we don't pose a danger to the lives and health of others during this shutdown. However, the answer to helping those looking to get back to work must not be to ignore the threat of the virus and sacrifice lives because of our willful blindness to the continuing threat. Instead, we'll press for common sense, fact-based, science-based solutions that protect the economy, including our local small businesses, while valuing the God-breathed gift of human life. There must be balance. How in good conscience do we ask God to protect our lives and health if we disregard those living on the edge who were struggling, living paycheck to paycheck before all this? And likewise, how in good conscience do we ask God to bless our businesses and send us prosperity if we discount the importance of the lives and health of our neighbors? In this, as in all things, I intend for the goal of the city of Lawrence to treat others as we would wish to be treated. The war is not yet over, but I'm confident of the outcome. Together, respecting each other, caring for each other, supporting each other, and yes, that means buying and supporting local businesses and loving one another, we will ultimately defeat our enemy and recover from this. Until then, let's keep each other up. Forget about political parties and the things that tend to divide us and support each other. Make each other laugh, stay positive, and remember, this too shall pass. That's all for now. God bless each and every one of you.